I'll ask these folks to go ahead and take their seat then. Okay. We have a microphone at each one of the desks here, so I'll ask you guys to kind of share that if you don't mind. When I came in earlier, I had the great fortune of meeting Dr. Hashmi first, and so I was asking him a little bit about this concept associated with the Mayo Clinic Care Network, and so I'll ask the doctors from here to kind of talk about that a little bit just so we can get an idea of how these, and I'm going to use the term, kind of satellite services work with the Mayo Clinic. Could someone speak to that, please?
Well, let me get started. So I do have an additional honor. I serve as the liaison for our medical staff for the Mayo Clinic Care Network services that we have the opportunity to access. And I think from the practicing physician standpoint, what is most remarkable is our ability to request and employ what we call e-consults, or what they call e-consults. With an e-consult, if we have a patient with a problem, that although we can diagnose it and we can come up with a therapeutic plan, if we come up with a roadblock, or if we can't make the final diagnosis, or if we can't be certain that we've taken care of everything that we need to take care of, we can put this together, package it, and electronically transmit information to, usually I think it goes up to Rochester, and it will be actually reviewed and placed on the schedule of a specialist, usually a specialty that we request. So in my practice of infectious diseases, if I have a problem I can't get to the bottom of, or if I don't know which is the best route of treatment, when I fill out the request, I ask very specific questions. I generally refer to infectious diseases there. I might have a question that goes to a subspecialist in infectious diseases. And this patient request, this consultation, will appear on that physician's clinic schedule as if the patient is there. My understanding is they often will have a full hour booked to see that patient, while they won't be seeing their own patients on their clinic patients on that day. They'll have access to our clinical record, access to our laboratory results. If it is a patient with a situation that would require evaluation of pathologic results, slides are actually mailed up there before the e-consult takes place, and their pathologist at Mayo will review those slides, and they'll read it as if the patient is there. And then they get all this done amazingly, usually within 48 hours of the time that they get the request, and it is electronically transmitted back to us. The other thing that's amazing, I know Dr. Hashmi and Dr. Dishman has experienced this, the physician doing the consultation will often give us a call. And they're very gracious, and oftentimes we had everything right, and it's very reassuring. It's reassuring for our patients that the experts at a place so famous as Mayo Clinic have reviewed their case within days of the time that the patient's been in our office. Patients had possibly all their questions answered, possibly they have further questions. It may be a recommendation that the patient travels to Rochester or Phoenix or Jacksonville to be seen in person. It's just a phenomenal process and very collaborative. Again, I know Dr. Hashmi's had similar experiences.
I agree with Dr. Jones. It's a remarkable service we have. The main concept is to serve the patients while keeping them in the community and providing the state-of-art care over here. So, as you know, I'm a hematologist oncologist, and this field is rapidly changing, and innovations are happening at a very fast pace. But still there is a lot of areas which are in the gray zone, and we need opinion from the physicians who are doing one particular type of cancer or one regional cancer for a long period of time with extensive research. So having this service available at our fingertips, especially as a physician, we put the consult in the electronic system. We have a dedicated physician who gather all the information and send it to Mayo Clinic. And within 48 hours, 72 hours, we get information or their opinion right away to us. And in large number of times, they call us back and they explain explain what they are thinking. They discuss the case with us. So, and in a very kind, gentle way, and they're really concerned about the patient, their well-being. So it's an excellent resource we have in which we can provide, especially our cancer patients who are very sick and they cannot travel far distances. And it has not only a physical and mental burden, but also a financial burden. So having this service available here at Trauma Wales in collaboration with Mayo Clinic is an excellent resource. So,
Would you like to make a comment?
I think from my perspective as a general internal medicine specialist and seeing people as they're first admitted to the hospital, when we began this program, it was a collaborative effort largely directed at subspecialty care. We see quite complex patients here, as does everyone everywhere. And one of the things that we became interested in very quickly was how could we access this information for our patients who are inpatients here, who are either not stable enough to transfer or with a, as they spoke about in the film, how can we collaborate and how can we bring this to the patient right at their immediate time of need. So while it was not the first thought with our collaboration that we would utilize this on a real-time basis with inpatients, the practicality and the immense amount of scientific evidence that we could bring to bear to our patients in a short period of time became rather evident. And so we quickly began pushing forward with the ability to utilize this information and this e-consult on patients who are actually in the hospital here. And while that didn't start out to be our primary goal, it quickly developed into one of the major benefits of this program, that I can actually be seeing someone here in Topeka, Kansas, and within 24 to 48 hours, I can have multiple subspecialty opinions in collaboration with the wonderful subspecialists that we have here. And oftentimes, more than not, just verifying what's been done here and making us feel more at ease that while we have the right diagnosis, we have the right treatment, perhaps we've only seen this a few times, whereas you can speak with someone directly who's looking at your patient with you electronically and can support your diagnosis and support your care, and the collaborative effort that brings to the patient and the reassurance that it brings not only to the patient's family but to the caring physician is priceless.
Yeah, sounds like that would give both you as a physician and the patient a lot of confidence in their treatment plan.
Absolutely.
The title of this show is The Mayo Clinic, Faith, Hope, and Science. And so I want to start with you, Dr. Schiebmeir, on this one. Without getting too religious or anything, let's talk about this concept of faith and what that means in this. Because the way this started was kind of, serendipitous. Yeah.
Yeah, I was going to say we should give a shout out to the Sisters of St. Francis for their generosity and their hard work. And I was thinking when I was watching this that the Mayo physicians, the two brothers, were able to pay off their house most likely because the nuns worked for free. But that's not bad. So I think when you think about faith, and Eugene, you're probably going to talk about hope as well, I think there are multiple layers to that. I think from the healthcare provider, the physician side, they certainly need to have faith in their training. They need to have faith in the system that they work in. They need to know that we all have each other's back, so to speak. I think from the patient's perspective, they definitely want to have faith that the system will watch over them, that people really care about their well-being, and that whether it's the physician in the room, the nurse, someone from the janitorial service, someone is paying attention to them in a really important way. So I'm trying to really get non-religious here, in that I think faith is more about that the care that's provided is holistic and well thought through.
Would one of you physicians like to make a comment related to the whole concept of faith and how that might play a role in modern day medicine? Ooh, I like this. Stump the physician.
I'll nominate Dr. Dishman to answer that question.
I think the important thing is that whenever you talk about faith and everything that encompasses and how much it means to each of us, one singular thing that we can agree on is that the important part of faith is developing personal relationships with the people that are caring for you, the people around you, and the people that you've entrusted your life to. And that is a concept which runs throughout this program of collaboration and caring. And I think that's really the key when you talk about faith. It's impossible to have faith without a personal relationship with the people you're caring for and the people that are caring for them. And I think that's one of the really powerful things about this program is that those physicians from the Mayo Clinic who work with us on this, they come here and they spend time with us and they get to know our culture and ensure that it's going to meld and mesh with the Mayo culture. And so we learn from them, and I've had the wonderful experience of having them learn from us. And so I think that it is that powerful personal relationship that instills faith in the program, and from my personal standpoint, it instills faith in the culture that we're building and developing.
As Dr. Schiebmeir suggested a moment ago. So let's talk about hope, okay? One of the things that we saw in here was we saw at least a couple patients who specifically decided to come to the Mayo Clinic or were referred to the Mayo Clinic. And each one of them seemed to come to that process with a sense of hope that this gives them another level of possibility in treating whatever disease or whatever infirmity it is that they might have. Talk about the issues of hope and how that works in patient care. Any one of you?
I addressed it to you.
Well, maybe I'll bring the nursing side to this part of the discussion. I was thinking about this, that every time somebody walks into the patient's room, whether it's the outpatient clinic, at home, in a home setting, or in the hospital, and particularly in the hospital when they're so acutely ill, just our body language and the words we choose have an immediate effect on that sense of hope for the patient. And the physicians that are up here are just exemplary in their ability to demonstrate that every single moment that they're with a patient. And I would say that I know a lot of the nurses that work at Stormont Vale, and I think they embody that. But I do think that is so important because I think sometimes it's just the lack of a smile, the lack of eye contact. Maybe there was a conversation outside the hall that when you're sick, you don't really understand what's going on. And so sometimes that moment where you really need something, when a patient really needs someone to come in and lift them up, can be missed if we're not attuned to that. But clearly, the patients in the movie that we saw tonight had very unique, very challenging healthcare problems. And I'm not trying to lead it here, Eugene, but the science behind creating that hope was, was phenomenal. Yeah, but it's more than just science. It's also that, again, that perception by the patient that Dr. Dishman talked about, that people really care about you, that they know about you.
So I have a little struggle with that concept of hope in the concept or in the context of the parts of the film that we saw today for these very, very specialized niches and treatments that can only be offered and developed in some very, very special places, some things that we just don't have the volumes, we don't have the subspecialists to develop. What we do see in a hospital this size and a community this size that I think is reflected in the film, the vast majority of the time we can provide that hope. Most of what we see, if we spend the time to connect with the patients and work with our colleagues and talk to each other, which is sometimes a stretch, we can predict to that patient and interaction with the patient and the family that, we can figure this out and we can make you better and we can take them through their journey over several days. Again, that's what it works. Can we develop and do what they do in a large, very diverse and specialized place like Rochester and Mayo? We can't do that all the time. We have this unique collaborative opportunity with them. We've had with regional medical centers as well that we can refer to, but we've never had that personal interaction. It's never been available. I've been doing this for 30 years here and been communicating with physicians in many different places. And I do think that must be unique to their culture, the way they develop and the way they build. It's reflected very well in the film.
Yeah. Go ahead, Dr. Hashmi.
Definitely. If you look at the hope, I think it's a blessing for mankind. If you take the hope away, the meaning of life goes away. So that's very important in all aspects of life, and it becomes very important in healthcare. And specifically, when I look at my field, cancer field, when I started training, definitely I struggled how to balance hope with the patients who are terminally ill and what hope means to them. I cannot tell them that they will be living for a long period of time. And that's the point I struggled. What is hope? And then when I talked to my mentors and other physicians who were in this practice for a long period of time, what I learned is it's not, hope is every day. It's sometimes we have to establish our short-term goals and hope to achieve that. So sometimes the hope for those patients to attend the graduation ceremony of their kids or a wedding ceremony of the daughter, even to go on a vacation or even to attend a church service, that's the hope they undertake these treatments and all. So that's the essence of hope there. So it's not necessary that we will achieve everything we wanted, but it's always day-to-day basis or short-term we have to achieve and hope those things. So that's the essence of it. And I think that's the main thing we all do. And similarly, when patients, like our collaboration with the Mayo Clinic, that's what the patients are hoping, that to know what else is going on beyond our facility or on a larger scale. And when they get their opinion in collaboration with us, their hope is fulfilled. They don't have to travel that far away. So it's all perspective, but it's very important to have hope. If you take the hope away, then it becomes very difficult.
Dr. Dishman, do you have a comment? Okay.
Nothing to add from the purveyor of hope.
All right. Well, following the other moderator, Dr. Schiebmeir, let's talk about science. And we'll start with you, Dr. Hashmi. Dr. Dishman mentioned earlier about how important it is to be a part of this collaborative process that happens with Mayo. But I know that especially in your area of speciality, that research and new tools, new procedures and all that stuff are extremely important. Can you talk about just a little bit about how that works within the Mayo framework, the research that is being brought to the table, the types of new techniques and all of that stuff that is going to be helpful to patients, because most of us as lay people don't understand all the stuff that happens years and years and years of advancements before we're in a position to take advantage of those things. Would you talk about those?
So definitely, as Mayo Clinic is at the cutting edge or at the forefront of the cancer research also. So many times they are having a clinical trial or they are testing a drug which is not available other places, and they are looking into that. So when we are in touch with them or we discuss the case, and especially we have already used several lines of therapy, and we don't have any other option left. That's the point, a discussion with them if they have any particular clinical trial available to send the patient over there, or many times there are trials which are available nationally and they are available with us also. So they guide us that will be a very good trial for the patient. So that helps. Similarly, they are also testing several technical advances, like Watson was one of the project, and we participated in that, and it helps. It tells us that out of thousands of clinical trials, what particular trial will suit particular patient. So we, at least one or two patients, we contributed to that project, or it was a pilot project, so we were part of it. So it feels very good to be in collaboration with them and providing all this to our patients here in Topeka.
Do any of you ever find that it might be helpful to actually make the trek to the facility and to meet with some specific doctor or some specific, some specialist that you've worked with in previous months, previous years?
So that actually does happen. I was just in Jacksonville. This is not exactly what you're talking about. We had 10 of the members of the Mayo Clinic Care Network participated in a job fair for their residents and fellows in training. And so we went down there and more or less were recruiting. So that isn't exactly that. That's the only time I've been to Jacksonville. Dr. Hashmi and I and a group from oncology went to Phoenix early in 2017, or was it 2016? And it was more or less a service line visit, and we had the full attention and the full participation all day long from one of their clinical oncologists, the physicians that spent the day with us, and several others. A physician I happen to know who was originally from Kansas City, a palliative care oncologist, spent half the day with us. We had radiation oncologists that part of the time, so we met these people face to face. And so that's another part of being a member of this network. We have these, I think they're referred to as healthcare consulting hours, and we can use those for events like that. Kevin Dishman, you should speak about the leadership NIAID training that you participated in.
We had the opportunity to spend almost a week in Rochester and had a wonderful experience, not only learning about the things that they're doing to try to solve new challenges in medicine. We know that most doctors now are employed in one way or another, and as they talked about today, that focusing on how doctors practice differently, how do we avoid big problems in medicine like burnout and overwork and the problems that the doctors are facing. One of the most important things you learn is that we're all facing this together as a profession, and how they are approaching that, and how we are approaching that, and what we can take away from there. We had the wonderful opportunity. We have a terrific post-acute care program here, and Mayo Clinic was just in the process of developing their post-acute care, and the director of that program, Juanita Breeding, went with me, and so suddenly she sort of disappeared and left my side because they were picking her brain and wanted to know about how we had structured that program, and it was just wonderful how we could bring that information from our side of the collaborative to them as well. So that was a wonderful opportunity.
Great, great, great. Let's talk about the concept of excellence as it relates to healthcare and the healthcare industry. And let's start with the idea of how do you instill the ideology of excellence, especially starting with the college-educated student who may go on to be some type of healthcare professional. How do you get people to rise to the level of the two brothers that did so much at the Mayo Clinic? I'll start with you, Dr. Schiebmeir. So you weren't ready for that one.
No, I'm always ready, Eugene.
Yeah.
Well, I think one thing that is crucial today, but also going forward, is that for individuals who are interested in a healthcare career, that they need to be curious. And that, more than anything, is really important. They always need to keep learning. So for educators, it's important that we have curriculum, whether it's in medical schools or residencies or nursing programs or allied health, that we instill in them. We don't take it away. That native curiosity about what's happening, why is it happening, what's going to happen next, how do I fix it? Maybe I can't fix it, but what else can I do? Because I think clearly the Mayo family was driven by this notion of how do we make it better? And I think if you're not curious, you really have no passion for making things better. But that's my perspective. I'm not sure that would be shared by all. But the other thing that I think you see happening in higher education is a real push to help with decision making. Because again, if you have knowledge but you don't know how to use it and how to help others use it, you create a health system that's not very stable. And then the last thing, and we talk about this a lot in nursing, is we need to own it. And I think you see this at Mayo. I would just say a shout out to the School of Nursing. We have had 3 of our nursing students all attend the Mayo residency in the summer, and our student of about 4 years ago actually gave a speech to the nursing students who were part of this residency program, and they have about 1,000 applications, and they take 100 of those students, so you have a 1 in 10 chance of getting into this residency. And we've had 3 graduates all go up there. And I think what they see is much like at Stormont, the magnet status, it really instills upon them this notion of quality. But really, you can't have quality if you don't have ownership. And that is, when that patient's in front of you or those patients are in front of you, you own that process of care. And if you don't own it, something bad may happen. And I think you really see that in the Mayo system, as well as Stormontville. Okay.
Well, let me ask this question then, and I hate to we only have about 3 or 4 minutes left, and I hate to kind of end on this question, but I think it's one that everybody kind of wrestles with. Even when you go back and you take a look at the early start of the Mayo Clinic, one of the things that we realized was that it was difficult to build that hospital, and no one thought that it was actually going to happen. It's even during that time, it was extremely expensive to go abroad and to learn new techniques and to meet with people and all that type of stuff. The field that you guys have chosen to be in is a very expensive field to be in. I mean, it's expensive from an education standpoint. It's expensive to maintain a private practice. It's expensive to do whatever it is that you do. What is it that we need to do in this country to make things a little less costly for both you all as practitioners, as educators, and also for patients? Is there an answer to that one? Sorry.
Definitely. Important thing is, life is priceless. That's the most important thing. So there is a cost to a thing, and then you have to look at the value of the thing. So definitely the expense and the cost we incur, but the value we provide, or any physician or any medical services provide, that's the important part there. So there is no comparison to what the value we get out of it towards that cost. And then when definitely we cannot ignore cost. We live in this society and this is a reality of life. But I think efficiency and innovation, that will address our cost issues. That's what I personally think. Yes, it's day by day the price is going up, but the way we will be providing the care in future, the quality measures, the newer technologies, and our emphasis on decreasing the wastage, I think that is what it is. Actually, in current medical practices all over the nation, and even if you go beyond USA also, there is a lot of wastage. So I think we have to cut back on that wastage. That's the most important part in there. And same thing if you go to some other countries where we don't have this kind of healthcare available, or even healthcare not available, and you compare them, then we see there is a lot of wastage which we can cut back. So I don't think so that we should be cutting back on our innovation or science. Like in 60s, the USA went to moon. We could have cut back, there was a cost to that, but the value it added, it was incomparable to anything. So if we start thinking and putting bars on our innovation, then it will be a problem. We will lose our edge there. We have to just look at how we will cut back on our wastage and how to make this process efficient. And that's the answer to that. But I know there are a lot of smarter people who are trying to answer this. It's a complex question, but that's what I think.
Anyone else have a comment? Okay. Go ahead.
I think I can add, I think you put it eloquently. I think that removing waste from the system is probably one of the chief ways that we're going to do that. And then probably the other primary goal we must have is to remove variability. There is a right way to do things. There is a best way to do things as medical knowledge advances, and reducing that variability in medicine, I think, is going to be one of the strategies for decreasing cost and removing waste from the system.
Yeah. Well, I want to thank all of you for being with us this afternoon. Thank you, Dr. Dishman, Dr. Hashmi, and Dr. Jones, and Dr. Schiebmeir for being with us. The show is entitled The Mayo Clinic, Faith, Hope, and Science. It will premiere on KTWU on September 25th at 8 p.m. Hope that you all will watch. Okay, thanks for being here.
Thank you.
Thank you.